Excellencies, honorable ministers, distinguished delegates, my very good sister, Susanna, ladies and gentlemen. Prior to 23rd March of this year, the world's public health communities, also here in Europe, were focused on a number of major health issues, health threats, big picture needs, and priorities for the future. Issues like the rise of non-communicable diseases, antimicrobial resistance, universal health coverage, climate change, and the post-2015 development agenda were being debated. Many were looking forward with great anticipation to the second International Conference on Nutrition, being co-hosted by WHO and FAO in Rome in November this year. The focus of the public health debate changed, at first very gently. On 23rd of March, when WHO confirmed the first case of Ebola virus disease in Guinea, that announcement, ladies and gentlemen, of a newly confirmed case barely raised a ripple in the international media. The world, it was felt, would not notice or feel a thing from the outbreak in Guinea. No one was deeply worried at first, not the country, not WHO, not the partners we usually work with during outbreaks, and not the key international non-governmental organizations. Look where we are today. All of you read the headlines and watch the news. Nearly every single day, on a US or international Google search, Ebola is either number 1 or number 2 among the top 10 news stories. Like other parts of the world, countries in this region are on high alert for any possible importation of the Ebola virus in an air traveler. Hardly a day goes by without rumors of an imported case at an airport or in an emergency room somewhere in the world. Governments are right to bring out the hazmat suits and showcase their isolation rooms. This reassures their citizens and their media crews that the country is well prepared to stop further transmission should an imported case occur. This is understandable. The virus is deadly. The disease is dreadful. People are afraid. Ladies and gentlemen, this is the largest, most severe, and most complex Ebola outbreak ever seen in the nearly 40 years history of this disease. This is a fast-moving outbreak with a number of unprecedented features that is delivering one surprise after another. This is an unforgiving virus that shows no mercy for even the slightest mistake. Today, nearly 300 healthcare workers have been infected, and around half of them have died. Before the outbreak began, the 3 hardest hit countries, namely Guinea, Liberia, and Sierra Leone, had only 1 to 2 doctors available to treat nearly 100,000 people. The death of every single doctor or nurse diminishes response capacity significantly. As we look at what this virus has done to affected parts of West Africa, every country in the world wants to keep the Ebola virus out of its borders. What we see is this: decimated families and communities, entire villages abandoned as everyone dies or flees, uncollected bodies, well over 2,000 recent and fresh graves, orphans that no one will shelter, and hospitals overflowing or shut down entirely. In Liberia, 14 of the country's 15 counties have now reported confirmed cases. The number of new cases is increasing exponentially, yet there is not one single bed available for an Ebola patient anywhere in the entire country. In trade, tourism, and travel, all of sub-Saharan Africa is suffering. The perception out there is that this is an African disease, that all of the African region is somehow contaminated. This is, of course, not true. People don't even bother to look at maps. And the whole continent is being stigmatized unfairly, unjustified. Here is what the chief of the African Development Bank had to say, and let me quote. Revenues are down, foreign exchange levels are down, markets are not functioning, airlines and ships are not coming in, development projects are being canceled, and business people have pulled out. In some areas, no health services whatsoever are functioning. Not for HIV/AIDS, malaria, TB, Lassa fever, typhoid fever, cholera, or dengue. Not for childhood diarrheal disease and pneumonia, not even immunizations and safe childbirth. Not for anything. As a team of WHO emergency experts observe, and let me quote one of the experts, delivering a baby in Liberia is the most dangerous job on this planet. Honorable ministers, can you imagine, just imagine for a moment, something like that happening to your country, to your people? I thank the many countries represented in this room. I thank you, the European Union, and others for the tremendous support you are providing to the governments of affected countries and to WHO and other partners. The whole world is watching this disease as we all together fight back in a spirit of global solidarity. A humane world cannot let the people of West Africa suffer on such an extraordinary scale. Ladies and gentlemen, what does this outbreak that has been making headlines for months tell us about the state of the world at large? What does it tell world leaders and the citizens who elect them about the state and status of public health? I see 6 things. First, the outbreak spotlights the dangers of the world's growing social and economic inequalities. The rich gets the best care, the poor are left to die. Second, rumors and panics are spreading faster than the virus, and this costs money. Ebola sparks nearly universal fear. Fear vastly amplifies social disruption and economic losses, well beyond the outbreak zones. The World Bank estimates that the vast majority of economic losses during any outbreak arise from the uncoordinated and irrational efforts of the public to avoid infection. Third, when a deadly and dreaded virus hits the destitute and spirals out of control, the whole world is put at risk. Our 21st century societies are interconnected, interdependent, and electronically wired together as never before. We see this now with a very dangerous outbreak in Nigeria's oil and natural gas hub, the city of Port Harcourt. Nigeria is the world's 4th largest oil producer and 2nd largest supplier of natural gas. If not rapidly contained, that outbreak could dampen the economic outlook worldwide. The Nigerian government has launched a massive response effort and makes substantial resources available. WHO has a team headed by one of its best epidemiologists on the ground in Port Harcourt. But far too many people had very high risk exposure on numerous occasions. Fourth, decades of neglect of fundamental health systems and services mean that a shock like an extreme weather event or a disease run wild can bring a fragile country to its knees. You cannot build these systems up during a crisis. Instead, they collapse. A dysfunctional health system means zero population resilience to the range of shocks that our world is delivering with ever greater frequency and force. We know that higher numbers of deaths from other causes are occurring, whether from malaria or other infectious diseases, or zero capacity for safe childbirth. We do not know precisely the size of this emergency within the emergency, as systems for monitoring health statistics, not good to begin with in these countries, have now broken down completely. But you do need to understand this. These deaths are not collateral damage. They are all part of the central problem. No fundamental public health infrastructures were in place. And this is what allowed the virus to spiral out of control. In the simplest terms, this outbreak shows how one of the deadliest pathogens on Earth can exploit any weakness in the health infrastructure, be it inadequate numbers of healthcare staff or the virtual absence of isolation wards and intensive care facilities throughout much of sub-Saharan Africa. Here is one of the few things that I'm glad to see. When presidents and prime ministers in non-affected countries make statements about Ebola, they rightly attribute the outbreak's unprecedented spread and severity to the failure to put basic public health infrastructures in place. Do you think these messages about the importance of health systems, so forcefully articulated by this region and so well backed up by your evidence, began to sink in? The fifth thing I see in this is, and I feel very strongly about this point, Ebola emerged nearly 40 years ago, when all clinicians, why all clinicians still are empty-handed, with no vaccine and no cure. Because Ebola has been historically and geographically confined to poor African nations. The R&D incentive is virtually non-existent. A profit-driven industry does not invest in products for markets that cannot pay. We have been trying to make this issue visible for ages, most recently through the deliberations of the Consultative Expert Working Group on Research and Development, Financing and Coordination. And this is a subject that this region has been extremely active, and I thank you for paying attention to that. Now, people see the reality of this R&D failure, this market failure, on TV screens and in the headline news. The world's empty-handed clinicians in their hazmat suits trying to help Africa's desperate poor, putting their own lives at risk and losing them. Finally, the world is ill-prepared to respond to any severe, sustained, and threatening public health emergency. This statement may sound similar to some of you. You can say déjà vu, because it was one of the main conclusions of the International Health Review Committee, convened to assess the response to the 2009 influenza pandemic. The Ebola outbreak proves beyond any shadow of a doubt that this conclusion was spot on. as you are discussing and debating the international health regulation capacity building, it really disturbed me when so many countries in WHO from the 6 regions still have not built the core capacity required for surveillance, to detect, to diagnose, and to respond to outbreaks. Perhaps this Ebola outbreak will make the point very clear that we have no time to lose. I also see 2 specific lessons for WHO. One, we must continue to push for the inclusion of health and health systems on the post-2015 development agenda, as we discussed yesterday over lunch break. We now have much more compelling evidence for doing so, and a much more responsive audience. People are now willing to hear arguments that have fallen on deaf ears for years. The importance of building health systems capacity. 2, the pressures of this outbreak are unraveling some weaknesses at WHO, some dysfunctional elements that must be corrected urgently as part of the organizational reform at all 3 levels of the organization. At the same time, I want you to know that this organization can move very fast and effectively in some key areas. 2 weeks ago, we brought together the world's leading experts on the many complex issues surrounding the use of experimental medicines and vaccines during this outbreak. As a result, this could be the first Ebola outbreak in history that can be tackled with vaccines and medicines. Perhaps. For vaccines, testing in human volunteers has already begun. In all countries, if all countries, I see the word countries instead, if all continues to go well, 2 vaccines could be ready for progressive introduction near the end of this year. Some 5 to 10 drugs are being developed as quickly and safely as possible. Ladies and gentlemen, even if we don't manage to get the benefit of these experimental therapies, this would be the outbreak that will pave the way for the world to have interventions to deal with future Ebola outbreaks. One thing I can guarantee, we are going to continue to see Ebola outbreaks. Ladies and gentlemen, let's get down to business. You have a packed and important agenda. The loud screaming noise about Ebola must not drown out all the other health needs that are crying out for attention. You will be discussing the first report on the implementation of Health 2020. The region is at a crucial turning point for immunization. You have a good success story, but it is fragile. You will be looking at non-communicable diseases, one of the highest priorities for this region. You will consider ways to invest more in the health of children and adolescents, and what this brings for societies. HIV/AIDS and malaria are on your agenda, but so is viral hepatitis. Viral hepatitis has finally emerged from obscurity to receive the attention it deserves. Make that attention even sharper. You will be looking at what can be done to slow the rise of antimicrobial resistance. Some of your heads of states and governments have been very vocal in profiling what this trend really means for the survival of modern medicine as we know it. You must not drop the ball on any of these initiatives. Polio eradication is on your agenda. I want to assure you our efforts to finish the job are moving ahead full force. We need top outbreak managers right now for Ebola. but we are not pulling these people away from the very important polio eradication campaign. Ladies and gentlemen, let me once again thank you. And this regional committee has also another extremely important agenda item for the organization and for you. It's for you to nominate the next regional director, who is sitting next to me. I'm sure you will go through the very important governing body process. I think you make the right choice, a good choice.
Thank you. Thank you.
But perhaps let me take this opportunity to appreciate all of you. And I need to inform you that I need to depart earlier than I expected and planned, because there will be a Security Council agenda item to discuss Ebola. And I will be leaving as soon as the nomination of the regional director process is over, because by rules and regulations, I have to be present. And I will certainly do my duty. And then I'm going to miss your evening today, to your celebration, but I'm sure I will see some photographs. So on that, let me once again thank you for your attention.